right, so good morning everyone. This is Ankit, founder and director of Study Buddy Group. And I was discussing with my team that we should share something that will help our PCE students pass their license exam, achieve their dream in 2022. So we came up with this video where you can see one of our mentor, Komal, is interviewing one of our old student, Ankush, and Ankush is sharing about all the tips that he followed to score more than 690 points in PCE. So basically, Ankush is someone who scored above 90% in musculo, neuro, and even in ethics. It's very impressive. So please do take a look at this video. It has some very amazing tips, and I'll highly recommend you guys to watch it on a laptop or a desktop, because he's sharing something which may not come very clearly on a cell phone. All right, so please have a look and share your feedback with us. All right, thank you.
Hello, everyone. I hope y'all are doing wonderful. My name is Komal. I'm a resident physical therapist, Canada, and a mentor for PCE Study Buddy. Today, we have Ankush with us, who is a Study Buddy student, and he managed to score 696 in PCE return component. Isn't it wonderful? So let's talk to Ankush about how he was able to achieve this and get some tips which will help everyone who is preparing for this exam. Hi, Ankush. How are you doing today?
Hi, Komal. I'm good. Thank you for having me here. And that was a very, very elaborated introduction, which was not needed. But I appreciate your concern and thank you.
First of all, congratulations to you from the entire Study Buddy team for such an amazing result.
Thank you so much. I mean, the journey was not entirely mine, and the credit goes to the entire team, each and every teachers, my friends, you, everybody who were associated with my journey. So yeah, it was a great experience to be part of Study Buddy.
Can you tell us how long did it take for you to prepare for this exam, and how was your journey during this time?
So so the whole thing, like people were asking me, that how long it took me for the exam, what exactly I studied, how did I prepare my notes, what was my strategies, to pass and to score. Frankly, I never thought of scoring this much. The whole aim, and like everybody, the whole aim was to pass the exam, so that we can start work, and that's the basic criteria. Normally it varies from person to person. For me, it took me 5 to 6 months of time, because I was working full time, and in the last 1 month I took a break for 30 days, so that I can completely dedicate my each and every day, all my hours to for this exam, right? Because in the end it gets very exhausted, so you need to have some time for yourself as well,
right?
But as I said, it's completely it completely depends on person to person. Somebody is married, somebody they have kids, family, they have stuff also, so for them it may take longer time, let's say 8 to 9 months. So they need to plan it a little bit more in advance, that how long and how much time they are looking for to prepare. But yes, in a nutshell, last 1 month, guys, please keep it for this exam. Try to skip your work.
Critical, yes.
If you're working, whether part-time jobs or full-time job, try to get away from your social circle, social media, Facebook, your family. That sacrifice is required.
So Ankush, can you tell us when to exactly start preparing for this exam?
Yeah, it's a very valid question. So when I started preparing for the exam, I was preparing to go to Canada and give my exam, right? That time the COVID did not start, and there was no home proctor exam was there. But now it's already there, and then we have no idea how long they're going to keep the same trend. I would suggest anyone, the moment you start, sending your papers to CAPI for the credential evaluation, start your preparation from there only, because that whole process is going to take 6 to 7 or little longer because of the COVID situation. Utilize that time to finish the lectures, get enrolled with the course. Lectures will take approximately 2.5 to 3 months to get over. So you will have almost double the time, to finish your credential report or the whole evaluation process. And you can't do anything, in the evaluation. You just need to send the papers. Apart from that, you just have to prepare your IELTS exam, which is not so big preparation you require for that. And one is a bridging course. So I think meanwhile that utilize that time to go through the lectures, finish your topics, so that once you have the report in your hand, you're almost done. You just probably need 1 more month or 2 months maximum to give the exam. But
Yeah.
what people do, what I did, because I was not in the same scenario, because when we start preparing for the exam, once we have the report, so
Right.
I actually technically wasted my 8 months.
Correct.
So I would suggest to start your preparation, go through the lectures at least. That's the first thing I would suggest. Automatically you'll get a lot of time for the revision also. Probably you can see the lectures twice, which is more than enough to make the basics clear, or to make the whole foundation. And then going and reading from the books, not the entire books, but certain topics will be much easier. And you will say,
that's true.
this was not stressful, because then you will not realize that you have actually took 8 months to study, because you utilize that time, because you can't do anything. You can't give the exam. But once you have the report, you say, okay, I'm 80% prepared now. Let's give 2 months or, more time to solving questions and giving mock exams. And let's just give the exam.
Just book the exam and give it. Yeah, they'll almost be ready for the exam.
Exactly. So that I would suggest to anyone, thinking to go for CAPR and evaluation process.
As we all know, musculoskeletal is the most important subject, as almost 100 questions out of 200 are asked from this area. And
Yes.
you have scored 93%, which is, really good. So what helped you to score so well?
First thing is, again, the lectures. Lectures, made the whole journey very easy for me. And apart from that, I'm working in MSK from last 10 years. And my all interest also in MSK is always been there. So yes, combining those two things, which helped me to get this much score. But one thing is trying to thinking, so I'll help you, like visualization. One thing, try to see the whole scenario, try to connecting the dots, and thinking in a different scenarios also. So this is like one of the slides. Yeah. So how did I prepare my notes? First of all, for all the subjects, whether it's MSK, cardiopulmonary, neuro, ethics. So I used, everything on electronic. So Google Doc.
Okay.
Several reasons why, because my handwriting is not good, first of all. So I can never think of making notes, handwritten notes, because next day morning I will not understand what I have written. So that's one thing. But apart from that, it's easy to edit. When you're making notes this is what I realized when I started making notes, it's easy to edit. And I like to see more pictures, when I'm reading something. So it's easy to copy paste rather than, drawing something on the book. Again, everybody has their own choice. And also gathering every single thing in one place. Let's say this is like pulmonary. So I have made this pulmonary notes entirely from the lecture slides and something that I read from the books, which is Sullivan or Reed and John. But I gathered, let's say if I'm reading, if you go into this, let's say I have written pleural effusion. So everything which is important about pleural effusion for this exam, whether it has been discussed in the lectures or in the book, I have gathered everything in one place. So just before the exam, I don't have to go through different materials to revise. I have just this
quick
notes.
and easy.
That's it. So this is how I prepared my notes. Now for MSK, this is like one of the example. Let's say, this is one of the slide from Ankit sir's class about anterior compartment syndrome. And now what do you feel, if you think that some information that you want to add on to it, right? Whether that information is from the book related to some questions, which is again, very, very precise, or in regards to PC we are talking about. You can add up your own points down in the slides, and that's it. So you don't have to go through other materials and all.
Yes.
So that's how I prepared my notes. Easy to revise, easy to recall all the time. And for MSK also, especially, pictorials, like, put pictures more into your notes. So this picture clearly says, what is central stenosis and what is lateral stenosis. So if I see this thing, central stenosis basically is going to compress the spinal cord. So this is just one of the example. Like this whole picture clears so many concepts.
Yes, absolutely.
So lectures definitely, and try to connect one point to the another point, different scenarios, and solving more questions. that is something which was my major ingredients to pass and to secure decent marks. Yeah. Now, if you talk about MEGI, only tables. Every MSK chapter, they have given some differential diagnosis tables, which will easy for you to make more understanding and going through those concepts. That's it. So Maggie special test also highly recommend, like extremely important for the exam purpose. 3 to 4 questions will be there, and no other book I would suggest. Just go through the Maggie and you can see the videos from there. So it will help you a lot.
I find cardiopulmonary and professional responsibilities the most difficult subjects. So how did you prepare for these subjects?
Again, the credit goes to, without saying, to study buddy team. As I said, I was working for almost 10 years in MSK. Cardiopulmonary, neuro, and other topics was not really something I was clear, or I was enjoying it more. Especially, I was also scared when it comes to cardiopulmonary. Lectures, again, guys, first thing first, right? So finish all the lectures. So you will, if you can grab 70%, 60 to 70% of the lectures also, it is more than enough, right? And then again, start making your own notes, using the lecture slides. Again, pictures will be the major ingredients to understand the concept. If you're talking about shunting or dead space, if you can understand the picture, it will be easy for you. And then again, for cardiopulmonary specifically, I have seen a lot of YouTube videos. What is crackles, what is pulmonary edema, what exactly the effusion is, or let's say cardiac tamponade. We don't see these cases. I've not seen these cases in my clinical setting as of now. So those videos will help a lot to DD also between the conditions. So lectures, pictures, and YouTube videos. Sullivan, I would highly recommend for PC exam, plus Read and Chung, addition to case studies. So if you see so in Read and Chung, addition to chapter number 18 to 23, I would highly recommend.
Okay.
Plus case studies they have given in the end. Why case studies? Because in every case study, they have tried to incorporate 2 to 3 conditions. They have combined pleural effusion with pneumonia, or different conditions. And that's how they're going to frame the question in the exam. Mm-hmm. And wherever you come across in Read and Chung, especially in those chapters, PT management part for any condition, go through that and then try to split that whole concept into your own language. What could be the different scenarios? If I lie down the patient on the affected side, what can happen? And the non-affected side, what can happen? Those things.
So
right. So that will solve the major part, and then you will realize that, okay, I've ticked all the boxes. There's nothing left, and that is going to be very, very helpful. So, but first thing, lectures, and then books. Ethics is again, because I'm right now in India, so I have not worked in Canada so far, right?
Yes.
So for me, or for anyone who are not in their system, it's little difficult to understand the whole concept in terms of scenario, in terms of the ethical part, right? Mm-hmm. And Ankit sir have beautifully tried to bridge that gap. Okay. So he takes the classes, paid classes for ethics. I think that's 3 classes which goes back to back, and he has covered all the possible scenarios which is required to crack ethical part for this exam. So that's one thing. Plus, if you go to the website, College Ontario PT, on that website, I've taken the screenshot. They have given this content for every single chapter. Let's say I think this was about controlled acts. Okay. So go through that, see which points is important for you as a PT. And then on the right hand side, they have given a column about FAQs. So, frequently asked question about that particular topics, which is my next page. So first you go through the lectures, because that will again, make you more, make it more simple for you to go through the college website. And Ankit sir has covered more scenarios and more questions. So those questions plus the college website is enough. And ethical part is extremely important for the PCE, because right now I think it's a huge percentage, like the weightage for that they consider, and it's also important for us to clear in that ethical part as well.
And how about neurology and multisystem? Can you share some tips on how to prepare for these subjects?
Neurology, I think Mayank sir is one of the best
It's the
teacher I
great.
have. He's amazing. Like, again, the kind of fear that I had for cardiopulmonary, I had the same fear for neuro also. Because the only thing, I'm not practicing neuro cases, so you don't know, what kind of things they're asking, how it is. And
And neuro
his
is also
lectures,
more of imaginary and stuff like that. So yes.
yeah, I mean, hardly I think I've seen in last couple of years some cases which is stroke, not even SCI, some cases of Parkinsonism, but not in like very detailed way. How to do doing the assessments and all, because it's completely MSK practice that I'm doing. Again, lectures, he has made all the lectures, about even his detailed projection about one particular topic is amazing. So you can still recall every single thing that he has told in the lectures when you're writing the exam, the examples that he used to give. Okay.
Yes.
Apart from the lectures, so guys, definitely lectures is the first thing for neuro again. Plus, if you go and see few topics, few chapters from Sullivan, they have given tables for those particular conditions, which has got stages. So let's say if I talk about Parkinsonism, so what sort of symptoms, classical features you'll see in early stages, and then what you can do to manage those things in early stages. Same thing, in the middle stage, late stage. In the exam, they have started asking about, not just generalized Parkinsonism problem, but during the stage, what will you do? How will you treat? What will you see in patient going with a moderate stage or late stage or a chronic stage? So try to, go through those tables, which will help you to segregate the stages and then plan the treatment accordingly. And you can make your own table also. Like, you don't have to, read the whole points, but just segregate important points, which is different from stage wise. That's it. Lectures and few tables from Sullivan.
And what about multi-system?
Multi-system is, again, electro, diabetes, pregnancy. Pooja ma'am and Purvi ma'am have covered beautifully all the lectures. So I think going through all the lectures first, they have covered maximum number of questions also, and few topics that you can go through, Krishna, which is pregnancy, they have given nicely, obesity, diabetes, these topics, read from the books, which is PCE reference book, Krishna. So I've done that from those books.
And one last question, what strategies did you follow and you would like to recommend to someone who is planning to appear for this exam from your experience?
See, strategies I followed is something. First thing is, you have to go through the lectures. This is what I did. I did not jump to the books directly. From day one, I enrolled into the course. I started with the lectures.
Yeah,
That
and we'll
gave me
get lost if we just start from the book directly, right?
Yeah, I mean, I see, like, when people ask me, can I start with reading Kistner chapter 1 and Maggie? I completely understand, because you don't know what to read. And it's practically not possible for us, for me at least, to remember everything which is written in the book. It is not possible. Totally. And also, they're not going to ask exam as per the books. Like, the concept is going to be, which is there in the book, but the question formulation will be different. That is completely dependent on how you think, right? So first thing is lectures. Go through the lectures, and as I said, 60 to 70% is good if you can absorb that much, right? Then going through the reference book, guys. So which is given on the PC website, which is example for Kistner, they have different books. Durton, Kistner. For MSK, they have different books. Kistner, Durton, Maggie, and other. I have only gone through maximum from Kistner and few things from Maggie. That's it. Apart from the lectures,
yeah,
you can Yes, you can combine the lectures and the things that you feel is important for you to add on into your notes to have it on one place, which is again going to be very, very easy journey in the last 40 to 50 days. Okay, you don't have to go through jumping from one book to another book, which will be waste of time. Now, practicing questions is the must. You can read from different books, you can do anything, but if you're not done maximum questions, it's not going to be easy. It will be difficult to pass then, right? Maybe you have studied less, but you have done more question. I think for that person, it'll be easy journey.
Yes.
Because questions is going to solve your concept. It will build up new thinking about the same concept. Kistner will always say one thing about osteoporosis, right? But when you do 10 different questions on osteoporosis, you will learn 10 different things.
Absolutely.
So do maximum questions, and this is what I did, which I'll explain how I actually used questions as my revision material also, how it actually helped me. Mock exam, which is provided by Study Buddy team, paid exams. Try to do all those exams in a timely manner. I used to give every 1 week my exam, and I used to give my exam in the same time zone. So my exam was 6:30 p.m. Indian Standard Time when I gave my exam. So I used to give all my mock exam, try to give my mock exam in the same time zone. So my mind is also working. I practice my questions also during the same time zone.
It will be like
imagine if I'm sleeping for 1 month during that time. I'm not saying it's not possible. You can give any time, but just to tick all the boxes, you should be very, very alert during that time. So I gave my mock exam same time zone. Through the questions, you will get to know which area is something you're still lacking into it, right? And revising those area more than something which you already good at it. Basic strategies, no fancy stuff. Lectures again, books, questions. That's it. So let's say 200 questions, and that means 800 questions totally. And then revising those things and rationalization, it's more than enough. Apart from other books, other material. Now, how I used to solve the questions is every day, first thing in the morning, I used to take a set of 30 to 40 questions, right? This is like approximately 2 months before my exam, I started this thing. And let's say I'm solving this question. Doesn't matter if I get this question right or wrong. That's not something I'm looking at into it, right? But if I'm not clear with this option C and D, let's say, and in last 10 to 15 days from my exam, I have not studied any new topic or any new questions. Whatever questions I did from my mock exams, from different books, I used to revise all the rationale for that, and revising just my weak zones in last few days.
Yes, I think questions would cover most of the syllabus anyways. So
it is going not just most of the syllabus, it is going to cover all the syllabus. I think there will be some questions also you will see that is not required for PCE, which is okay. You can leave those portion, but keep your blueprint also in front of you always. Right. So you don't get lost. There is something which we don't have to study for PCE, which is okay, right? And for the weak areas, try to have a discussion with your study partner.
Yes, that is very important, I would say. Yes.
Yeah, this is how I used to do with my study partner. Every time in the last, I think 2 weeks, what we used to do is I used to go for a walk without books, try to recall the concept. And then she used to throw some topics on me and say, tell me everything what you know about this topic, about muscular dystrophy. And then I have to tell every single thing. And if I missed out on something, she will cover that.
Add up, yes.
And vice versa. So recalling is something which will be, which will bring a lot of peace for you in the last 3-4 days, because you already know everything, like most of the things. So you don't have to revise the whole blueprint, which is not possible. You can't revise every single thing last 3 days.
Yeah.
You have to keep those 3 to 4 days only for a very precise topics. So yeah, Komal, I think this is what I followed. Nothing fancy.
Wonderful. Yes.
Basics. And Study Buddy team really helped a lot. All the teachers, yeah.
Yes. Thank you so much for taking your time out and sharing your experience. I'm very much sure that this is going to help all the candidates who are preparing for PCE.
Thank you so much. And I this is a message for everyone. If I can be any help to anyone, would be really happy to do that.
We are always here for you guys. Thank you all for watching this video. And if you have any further questions, you can reach out to us via email. We would be really happy to answer. Thank you.
Thank you so much, Komal. Thank you. Thank you for your time. Bye-bye.